Hello, I'm Dr. Jack Wolfson, board certified cardiologist, and it is a pleasure to be with you on this podcast, and I hope you enjoy it. I think you definitely are going to. A little bit about me. I am a board certified cardiologist. This is a picture of my beautiful family. I did 4 years of medical school, 3 years of internal medicine, 3 years of cardiology training. I was with a very large group here in Arizona for 10 years where I was doing angiograms, pacemakers. I was the chairman of the Department of Internal Medicine, director of cardiac rehab, director of cardiology, and I was also selected as one of Phoenix, Arizona's top docs in 2011 and top holistic MD, as you see on the screen, for several years. And 2017 is fast coming up for the election here in July. So hopefully I'll be one of those selected as a top holistic MD once again. I am the author of the Paleocardiologist, Amazon bestseller. And there you have that information as well about all the different chapters and everything that's included in my book. And we've got 17 chapters. At the end of the book are 300 references to everything that I say inside of the book. So we start off talking about cholesterol, the importance of cholesterol, and then we look at LDL particles, HDL particles. We talk about nutrition. We talk about the importance of getting the stress out of your lives and how to deal with it naturally and its implications for heart health. And then we talk about the dangerous pharmaceuticals, the dangerous procedures that the typical doctor does, and then once again hone in on toxins and environmental pollutants and ways to get healthy, including my chapter 14, The Wonders of Chiropractic. And then finally, we talk about tests that you need and the best supplements that are evidence-based. So we want people to get that information. And today I'm going to be talking about one of those tests that are absolutely imperative for everybody to get. And that brings me into my subject for this presentation. And this is called leaky gut syndrome. By attending this presentation, you will learn how poor nutrition and toxins damage your intestines and cause a leaky gut. You will learn why a leaky gut can cause fatigue, weight gain, and just about every disease. You will learn the best tests to determine if you have a leaky gut, nutrition to heal the leaky gut, the lifestyle to heal the leaky gut, and the best supplements for repair of the leaky gut. Once again, this presentation is meant for information purpose only. The content is solely the opinion of Dr. Jack Wolfson. This presentation is not meant to diagnose, prevent, treat, or cure any disease. Please speak with your healthcare provider regarding any change in your healthcare plan. So enough with the legal mumbo jumbo. Today, we're going to talk about inflammation. We're going to talk about leaky gut syndrome. We're going to talk about oxidative stress. We're going to talk about immune system activation. We're going to talk about inflammation and leaky gut. Now, when my wife first talked to me about leaky gut, she mentioned the term leaky gut, and I kind of laughed in her face. I said, "Where did you get this diagnosis from?" I'd never heard of it before. And, and she said, "Well, that's, your issue. That's your problem. It's up to you to figure it out." So I looked in the medical literature and I couldn't find much in there. I talked with some doctors and no doctors had heard of it. But over the last 10 years, the literature has exploded on the concept of leaky gut, where once again, things get into the body that don't belong. And once they get into the body, the immune system activates, inflammation occurs, oxidative stress. Those are the body's responses to all of these toxins and bugs and gluten and food particles that are undigested getting into the body through the skin of the intestines. The skin of, basically the skin we have on our external is also internal, and we call those gut epithelial cells, and that controls, once again, what gets into the body and what should stay in the food tube and then out the other side. And once again, what the natural doctors have been telling us for years, now we can effectively diagnose. Here we've got the test from a company called Vibrant, and this is their wheat zoomer from Vibrant Wellness. And we can see here that they look at different things. They look at celiac and gluten sensitivity. They look for and that's consistent with celiac, but a lot of people do not have celiac, but they do have leaky gut. Sometimes we diagnose people with celiac, and celiac is a autoimmune gastrointestinal disease that leads to bloody bowel movements, severe abdominal pain, and a whole host of other long-term health issues. But we're not talking about that here. We're talking essentially about the leaky gut. But we have diagnosed people with celiac antibodies that may not even have any gastrointestinal symptoms whatsoever. So this is a very useful test to take a look at that. And then now we get into the leaky gut portion, and we see things like zonulin and anti-zonulin. And I'll be talking about this as we go along here: anti-actin, lipopolysaccharides. And then the company also looks at allergies to wheat germ. It looks at sensitivities to gliadin. So we're talking about gliadin and glutenin are two components of gluten in general, and gluten is that nasty protein found in wheat, barley, and rye. And when we talk about this is sensitivity, so your immune system is activated, and we see that here as immune fighting molecules such as IgA and IgG. But in the middle panel there, where it says wheat allergy panel, that's actually looking at IgE, or immediate sensitivity reactions to wheat. So someone eats wheat and they break out in a rash or in hives, have trouble breathing, or anaphylaxis, where they really stop breathing and the whole system shuts down. So we want to certainly avoid that. And then here, once again, we look at other components of that wheat Zoomer panel, and we look at the non-gluten components of wheat. So there are proteins that are in the wheat molecule that the body is sensitive to and creates an immune response. And the more response, the more the immune system is activated, and the more likely we are to have disease. Here's some evidence where zonulin controls the tight junction. So zonulin is a protein that allows things to get in the body that belong and keeps things out that don't. But when you have high levels of zonulin, it opens up the tight junctions, as you see here, where things get into the body that don't belong. And wouldn't you know it, that zonulin levels are higher in patients with coronary artery disease. This is from 2016, a very reputable science-based journal. And you can see here that zonulin levels are higher. So now you are opening up those channels into the body that leads to that three responses: inflammation, oxidative stress, and immune system activation. So this is a way to detect coronary artery disease in its earliest phases, where elevated zonulin, and then of course we do our best to correct whatever is causing the zonulin elevation. We are doctors of causation. Another part of that wheat Zoomer analysis looks at lipopolysaccharides, and the depiction here is that lipopolysaccharides are a sugar protein structure that is found on the surface of bacteria. That bacteria is getting in to the human body. It's getting in, and it's irritating and causing problems. Now, some is bound to get in just by nature, but we do not want a lot of lipopolysaccharides entering in, because as you can see on the slide, the higher the lipopolysaccharides, the higher the heart attack risk. What we thought was kind of theory is now turning out to be factual, and those holistic doctors knew it years ago. Here's some more information about lipopolysaccharides and what they do. They increase coagulability, or blood stickiness. They activate complement, which is part of the immune system. They activate receptors on cardiac myocytes, leading to all different changes. Decreases contractility of the heart, decreases vascular responsiveness, and induces or causes cell death, or apoptosis. We do not want a lot of these floating around. Leaky gut is linked to heart failure. This is from the Journal of the American College of Cardiology, the biggest journal in cardiology. And this information is almost 10 years old. According to theirs, altered intestinal function in patients with chronic heart failure. So leaky gut is linked to heart failure. So not a surprise when we think about what is going on fundamentally that we test for. We're testing for actin antibodies. And what happens is actin is part of the muscle structure. It is part of muscle fibers. Actin, along with myosin, makes muscles contract and relax, contract and relax. But what we see evidence of is that the immune system is attacking part of that structure. And now we want to go back and determine, why is the body doing this? But do you understand how exciting this is for a cardiologist? This really is so fundamental to disease, because actin is found in smooth muscles of the intestines. Actin is found in smooth muscle of the heart. Not only the heart muscle, but also the coronary artery disease. Ladies and gentlemen, what I'm telling you is that coronary artery disease is an autoimmune disease. The body is attacking itself, and it's not because it's deficient in statin drugs or aspirin or any other pharmaceutical. There is a cause, and now we have to find the cause of why the immune system is attacking body structures. And here's data from 2003, where we see these antibodies to actin are associated with thickening of the carotid artery in the neck. Once again, we have evidence that anti-actin antibodies are linked to increase disease in the artery of the neck, and certainly we can use that as a surrogate and say, well, if it's occurring in the neck artery, it's occurring just about everywhere else. Now, the pharmaceutical companies know that wheat causes leaky gut. How do they know that? Well, they tested something in 2005 where they actually coated a pharmaceutical in wheat proteins, knowing that it will cause leaky gut, with the idea of increasing absorption of the pharmaceutical through the leaky gut. And they proved that very successfully in 2005. Whether or not they are doing that to the pharmaceuticals, I am not privy to that information. When it comes to neurologic diseases, and certainly we are very passionate about the health and wellness of our children, but we can see here that in children with autism, 63% have antibodies that are attacking the brain, and this is only present in 5% of controls. So what is likely happening here is that you're getting this immune activation that's coming through a leaky gut. And this is a major, major problem in children with autism, and then anybody with Parkinson's, Alzheimer's, or other neurologic diseases. Because you can see here that antibodies against food antigens in patients with autistic spectrum disorders, we can see here intestinal permeability, leaky gut. 26% of the time, those antibodies were found in the autism group, and only 2% of the time they were found in children with that were normal. So clearly, when it comes to brain function, leaky gut is absolutely paramount. And if we heal the leaky gut, we will improve brain function. This slide depicts the pathway to leaky gut. And once again, everything to me is caused by poor nutrition and environmental pollutants. So all that stuff is going to cause leaky gut. And certainly in people that have a genetic predisposition, it can be worse. And what happens often is that some of these environmental toxins change the gut flora or the bacteria that are in the gut and lead to all different types of problems. And certainly this starts at an early age when you are a C-section baby, or you're not breastfed, or there's pesticides or early use of antibiotics, on and on and on. This will lead to a leaky gut. And once again, we have a depiction here of the test that we use to help determine that. And we have this available on our website, on our shop page, and I'll show you how to get there in a few. Now, going gluten-free improves leaky gut and autism spectrum symptoms. So once again, what can it do for somebody with Parkinson's or with dementia or other neurologic conditions? And I've seen this in my practice. We are seeing the success. To me, it all starts from food, food, food. We have our paleo pyramid here, the foundation of which is vegetables. And then after that, it's kind of up to you as long as it's on the pyramid. And we've got our meat and chicken and seafood and the eggs and avocados and coconuts and olives and nuts and seeds, fruit in season, healthy fats, healthy cooking oils. But the kicker is over here on the left where we say, it has to be free-range meats, has to be wild seafood, has to be grass-fed, has to be organic, and preferably local whenever possible. So this is our pyramid, and we get phenomenal results. I'm a big fan of the use of spices. So spice up your life, spice up your health conditions by adding things like rosemary and thyme and oregano and turmeric and cumin and black cumin. All different kinds of, any kind of spice in that spice drawer is going to provide health benefits. They're actually like little mini pharmaceuticals, so feel free to indulge in the spice industry. Alcohol is a problem with leaky gut, so be very careful with leaky gut and with alcohol use. Some information says alcohol is healthy, some information says it's not. To me, alcohol was not significantly or ever enjoyed by our Paleolithic ancestors, so we better think twice about drinking it. Melatonin in the leaky gut. So what happens when we get sunshine is that we make a lot of melatonin, and when you make a lot of melatonin, you don't have a leaky gut. But what they found was that actually when you have low melatonin secretion, that's linked to intestinal permeability and leaky gut. So we want to make sure we go to sleep with the sun down and awake with the sunrise. It's super simple. We want to avoid the artificial light as much as possible and follow that lifestyle of sleep with the sun down, awake with the sunrise, and try and get sunshine on a daily basis. Here we can see that leaky gut is linked to Parkinson's disease. So the literature is there. It's very clear this is a major problem, and the only way to know if you have it is to get tested, because you may feel fine until one day you don't. That is the purpose of getting tested. Stress is linked to the leaky gut. This has been seen in rodent studies. Stress is a problem. Stress causes cardiovascular disease, and now we know why. Stress leads to leaky gut for a variety of reasons. The leaky gut then leads to inflammation, oxidative stress, and immune system activation. And then you have coronary artery disease and heart attacks as a byproduct of that leaky gut and stress. So get the stress out of your lives. I talk about this in my book. We talk about stress modification techniques. If there's family members you need to excuse from your life, go ahead and do it, because you're not going to do any good for anybody if you're unhealthy. So if it's a career change, heck, I mean, I left a very busy cardiology practice to open up holistic practice and do the right thing. So if I can change, you can change. Celiac patients do have a higher risk of heart attack and stroke and cardiovascular death by 10%. It's not a tremendous increase, but it is an increase. So if we do identify that someone does have celiac antibodies, we want to make note of it. And celiac and leaky gut, and these are all, kind of one and the same problem. It's just the immune system is activated and causing bad issues. The good news is when you go gluten-free, a lot of those neurologic symptoms resolve, and it doesn't matter if you have celiac or non-celiac. When you have these abnormalities on your blood tests and you go gluten-free, you get rid of wheat, barley, and rye. You eat foods that are gluten-free, that say gluten-free on the label. Typically, when you stick with whole natural foods, you'll be in good shape, right? You don't have to worry about cucumbers or wild salmon having gluten on it, unless, of course, you're at some restaurant where they may have put some kind of dressing on there. And that's the beauty of doing these tests, is that now you get kind of proof positive where you can tell people, hey, listen, I am sensitive to gluten. I have a serious problem with this, and I cannot eat it. It makes going out very difficult, but my job is to give you the answers. And if you call ahead to different restaurants ahead of time, if you plan ahead, you can stay healthy. And a lot of my patients have been very successful in doing so. And now we've got our leaky gut protocol. We've got products that I've used with a lot of success to help heal the leaky gut. We test people at time 0, identify their problem, identify the leaky gut, and then we put them on the diet, we put them on the lifestyle, and then we put them on the leaky gut protocol, and we're getting tremendous results, as you will see. One of my favorite products is a protein powder. It's called our Paleo Cleanse. And we see tremendous benefit with this particular product. It's got certainly all the vitamins and minerals in here, but then over on the right side of the screen, you can see different things that are very anti-inflammatory, from pomegranate extract to flaxseed, which does tremendous benefits, quercetin and rutin and turmeric and N-acetylcysteine, which builds glutathione, and ginger, on and on and on. This is really such a super product. The proteins in there are pea and rice, so it is very well tolerated for people with allergies, and this is a product that if a vegan wanted to consume it, it is vegan compliant. Here's our product called Gut Shield. Has some fantastic nutrients in there, specifically the glutamine and the milk thistle. So there's some really good components to this product as well that help to heal up that leaky gut. And once again, we're seeing great results. We got our gut fuel here, and the gut fuel is made of butyric acid, and butyric acid is produced by colonic bacteria, and butyrate lowers inflammation. Why? Because it's sealing up that leaky gut, and butyrate actually helps to affect those actual cells of the immune system and really helps to boost up healthy immune cell system function. Butyrate may lower colonic inflammation and decrease the risk of colon cancer as well. And how about this? 2014, butyrate reduces plaque. How exciting is that? That we now have a supplement that has been shown in animal studies to reduce plaque in arteries. Love this stuff. Omega-3 supplementation increases butyrate-producing bacteria. That's always a positive thing. Omega-3, the only way to get it in any appreciable amount is from seafood. If you're doing seafood, great. Do the small fish such as anchovy and sardines, and I love the wild salmon. I love eating shellfish. And then loading up on our omega DHA is just another great way to add to it. Very evidence-based. What omega-3 does as far as secondary prevention, decreases chances of dying and heart attacks in people that have suffered heart attacks previously. Really exciting about how cardiac death is lowered by 32% and heart attacks are lowered by 25% just from fish oil. How wonderful is that? Another one of my favorite products is berberine. Berberine is just an absolute miracle product. It's kind of like a Swiss Army product in the sense that it does so much regarding lipids, regarding blood sugar, regarding cancer, regarding inflammation, prostate enlargement, infections, and then boom, it helps to heal the leaky gut. How wonderful is that particular product? Probiotics are certainly a mainstay for everybody, and the evidence is there on what probiotic can do for gut function and for leaky gut. So everybody needs to be on a high quality probiotic. And as depicted here, we've got a wonderful supplement that contains 30 billion live colonies in there. And it is in a blister pack, does not need to be refrigerated. It's just a wonderful product. And once again, this slide depicts all the different parts of the body that receive benefit from probiotic supplementation. You name it, the benefits are there on what probiotics can do. And in this particular study, this is just more evidence how probiotics reduce intestinal permeability, which is exactly what we're talking about today. Another side product we can use zeolite. We can use diatomaceous earth, that stuff in my opinion, and also in the literature regarding zeolite, what that can do to decrease levels of zonulin and have all the other benefits along with it. So put this into your armamentarium as well. And then here's what we do. We do the wheat zoomer analysis and we retest in 3 months and see how we did. So now we got case study number 1. We've got a 47-year-old female with a history of elevated cholesterol, inflammation. And she complains of this vague abdominal discomfort pretty much most of the time. And she is on a statin drug, Lipitor. And on examination, she has swollen hands and feet. Nothing dramatic, but just puffy hands and puffy feet. And you can see here on the left how we do a before panel on her, and we can see that she's got a lot of zonulin, antibodies to zonulin, anti-actin is very high in IgG and IgA form, and then evidence of wheat germ elevation as well as far as IgG and IgA. So clearly she's got leaky gut and she's got wheat sensitivity. Then we put her on the program, and 3 months later, we've lowered zonulin by a little bit, but anti-zonulin is now well in the normal range, and that nasty anti-actin particle that attacks smooth muscles, that attacks the heart, we've lowered from 1.97 down to 1.25. Still got some work to go, and then the wheat germ panel is dramatically improved. Here we have markers on the same person of elevated antibodies to gluten, and now we've kind of cleared all that stuff up. And if you take a look at this person's lab results, now don't forget this person was on Lipitor, so their cholesterol levels are going to be very low. But what my goal is to get people to their cave person cholesterol. And I think we are starting to achieve that in this person, although I think their diet could be better. And that's why we're not seeing the total results that we'd like to see. But the reality is the most important marker when it comes to cholesterol and lipids is actually a ratio. It's this ApoB to ApoA1 ratio. And before we were at 0.45, and then now we're at 0.7. So levels went up, but now we are off drug. So that's not really surprising. But what's really exciting here, if you look towards the bottom of the screen, you look at a marker of inflammation called HSCRP. And HSCRP was at 1.3, and now 3 months later, we're at 0.8. So we're making some good improvements with inflammation. And when inflammation goes down, so does your risk of heart disease, stroke, and dying. Now, when it comes to risky cholesterol and lipid particles, the oxidized LDL may be the holy grail when it comes to lipid analysis. And here we can see that our levels went from 61 down to 50 in the ox-LDL category at the bottom of the screen. And this is just really, really exciting to be able to make this impact and get somebody off the drugs. Case study number 2, we've got a 60-year-old male with a history of coronary artery disease and a heart attack and a stent to his LAD. And we can see that in pretty much all parameters, we're starting to improve. Once again, that anti-zonulin came down. A lot of these components regarding antibody response to wheat and gluten, gliadin, all those things are starting to normalize. And it's very, very exciting on the directions we're moving. We're moving positive in the anti-zonulin. We've still got some other areas to continue to work on, but that's okay. It took years for this person to get into this mess, and it will take a little bit of time to get out of it, but we're getting people out of it, which is really exciting. But look what we did for this person's cholesterol in that 3 months' time, how that all-important ratio, ApoB, ApoA, was 0.62. Now we're at 0.48. We're looking wonderful there. And then just look at the markers of inflammation, what happened. Oxidized LDL went from 71 to 48. This low-grade inflammation of the heart at 5.9 went down to 2.9. And then myeloperoxidase went from 3,400 down to 700. That's an 80% reduction. So very excited about that. And then here's another test from a totally different company. We look at markers of oxidative stress, and we see lipid peroxides went from 13.7 down to 8.5. And this nasty one here, this 8-dehydroxyguanine, went from 14, and now it's not even detectable in a 3-month time frame. Case number 3, this is actually from a young boy. And we can see here that sky-high markers of gliadin and glutenin, and now all those things are just about gone. So just super exciting on that panel there. And before I get to this, I'm going to go ahead and opt out for a second, and I'm going to get on to the internet. I'm going to get onto our shop page. I'm going to show you how you can order this here. So I'm going to go over to our shop page at thedoctorswolfson.com. Well, I hope your internet is faster than mine. And then if we go into the search our store, we can go and just punch in the word wheat, and then you'll see the wheat zoomer test pop up. And now you're on our shop page where you can get more information about the wheat zoomer, and you can go ahead and just add that to the cart and get get your information there. And then you go to the shopping cart, and then boom, you check out, and then we send you the kits. You find a local lab site, and you get the test results. You can use this PowerPoint presentation as your follow up on this to gain more information. You can also set up a 15-minute consultation if you'd like to go over the results of the testing by just giving our office a call. So let me go ahead back to the presentation here, and you can see our take-home points. Go paleo and use spices. Get your sleep, get your sunshine and quality, get out of the artificial light. Get chiropractic care. There's no doubt that chiropractic care helps with the autonomic nervous system, that innervates the intestines, and a healthy autonomic will no doubt decrease leaky gut. I want you to get active. I want you to get outside and go hike and bike and walk and all that fun outdoor activity. Get the stress out of your life and get happy. Of course, drink high quality water. Get hydrated. We have a water system on our shop page that we recommend as well called Pristine Hydro. We need you to get grounded where you walk and stand barefoot as much as possible. Go ahead and get tested with the best testing in the world, including the wheat zoomer by Vibrant America. More information on our website, on our shop page. And then, of course, get the evidence-based supplements, start the plan, and retest 3 months down the road and see how you did. So once again, I want to thank you so much for being on this presentation today. Be healthy, be well. We don't need the pharmaceuticals. We need to get the right nutrition. We need to get our sleep, get our sunshine, live like our ancestors did, and we'll live a long time. Be well.